Рой. Хаса и чё ты видел?
Гулян кашен и чё?
The ancient Karo culture and their spiritual practices have endured in small villages scattered across steep and rugged slopes of the Andes Mountains of Peru. The geography that has protected their culture also imposes many hardships on the Karo people. Severe climate, limited food resources, lack of infrastructure, and lack of basic services. They build their houses of field stone or adobes. Food is cooked over a tiny fire of sticks and llama dung, with no chimney to evacuate smoke. All transportation is on foot. Llamas serve as pack animals to carry sacks of potatoes from the fields to the farmer's home. This traditional way of life has changed very little over hundreds of years. Karo villagers suffer common ailments such as respiratory infections and diarrhea that sometimes lead to death because the people lack access to adequate medical services.
In this region, it's so difficult. When someone gets injured or a woman's labor is prolonged or complicated, they have to leave to get help. But to carry them so far over the mountain to a clinic is also very difficult.
Here, up in the mountains, we suffer from many stomach pains and lots of headaches. My sister-in-law died from some kind of pain in her abdomen. That was 2 months ago. She was only 17 years old.
When we need help, we have to walk long distances all day to get to the little outpost clinic in Kiko. When children get sick, sometimes they die. The mayor's son had an accident on his bike. He dislocated the head of the femur, and we took him to the regional hospital where he had surgery. I could not do anything but give him painkillers. By the time we reached the regional hospital, it had been 14 hours since the accident. Another emergency we had was the case of a child from the village of Yanaruma. About 15 days ago, the diagnosis was pneumonia, and the child died.
Almost every family has lost one or more children in childbirth, infancy, or early childhood from conditions that could have been treated to save them if they had medical care. Labor and childbirth pose grave risk to mothers as well. Without an obstetrician, women must deliver at home in crude circumstances with no medical assistance.
It is very difficult to be pregnant and to give birth as well. Everything is difficult here. Sometimes we die in childbirth. We deliver our babies with no medical support and in really rough conditions in our houses. There's nothing here in this empty canyon where we live. Where would we go for help?
If a woman has complications during labor, she would have to be carried on her husband's back 6 to 16 miles over steep mountains to the outpost clinic because there is no transportation. The Peruvian government has not provided adequate medical services to those isolated communities.
We do not have trained professionals. There should be a doctor or an obstetrician. And something else we urgently need is transportation. The motorcycle is really needed here.
We have patients who come in from villages far away. First, we would need an obstetrician who could take care of the pregnant woman in childbirth. An obstetrician is most essential here because we have pregnant women with medical emergencies.
Since we first met with the Kero people in the highland villages in 2004, Heart Walk Foundation has developed partnerships with these remote communities to empower them to build a more stable life. Better nutrition and food security are now a reality because of the greenhouses and the trout stocked in alpine lakes that Heart Walk Foundation donors have supported. The villagers do all the labor to build the schools and alpaca barns funded by our donors. But they still are in urgent need of medical attention for injuries, illnesses, and childbirth. With your help, we can protect the lives of Kero children and their parents, and we can help improve their health by providing better medical services and essential equipment to the medical outpost. $1,200 will fund an obstetrician for 1 month to attend births, save lives of mothers and babies, and care for patients with all kinds of illnesses and injuries. For less than $15,000, that doctor can treat several thousand villagers for an entire year. $2,500 will fund a sturdy motorcycle to carry medical staff across the mountains to outlying villages to serve hundreds of people throughout the year. $150 will purchase 1 bed and blankets for urgent care patients who must stay in the outpost clinic overnight. Your donation will help provide medical services and essential medical equipment for the Kero people living in the harsh highlands of the Andes Mountains of Peru. Your gift will provide a lasting return on your investment to benefit many people, saving lives and improving the health of almost 2,000 mountain people.